Thank you, Hindi team. Now we are moving to English session. Today is our 1689th day of continuous webinar without any break, without any leave. We are continuously continuing our journey with the help of all our participants and the faculties. And thank you everyone for joining with us. And now we will have a silent prayer. Good evening once again and welcome all participants for our English session. Today's our guest is Dr. PANKAJ and LATHIA. He is MD in Homeopathy and Ph.D. in Homeopathy. He is Professor of Community Medicine and Chief Consultant of Homeopathy Clinic, Surat, and has 15 years of clinical experience and 10 years of teaching experience. He is winner of Dhanvantari Award for repeatedly 3 times, and he is a judge of many schools, and he presented papers in many classes. And I'm welcoming Dr. Pankaj to IFPH session. Sir, you're welcome. Please.
Thank you, madam.
Sir, you can start now.
Am I audible, madam?
Yes, audible and visible.
Okay, good evening.
Good evening, sir.
Okay.
You can start.
Can you see my screen, madam?
Yeah, your profile, right? It's visible.
Okay. A very good evening to everyone. So let's start my research study. I am going to present my research work. First of all, my title name is Observational Retrospective Study, the Psychosomatic Disease and its Elements Factor, Emotional Suppression, and with its homeopathic management. First of all, I would like to tell you why I have selected this topic for my research study. As you all know that we all are living in the 21st century, and emotional suppression itself main cause of the many disease, because we are living in 21st century where many competitive drives and many survival issue, many emotional factor conflicts which are mainly responsible for the disease. So why I have selected this topic? So when I have seen during my internship, some cases were not responding to constitutional medicine. So what I feel recently, emotional factor, that was a main reason behind our failure. Because if symptoms are suppressed, then how can we get the clear homeopathic picture? And also second reason why I have selected this topic, no any system other than homeopathy which gives more important to this phenomena, suppression and cure. So I have selected this topic, but I could not understand what is emotional suppression. So what if it is emotional suppression, and how do I deal with it? Where can I find it? So many questions for little mind to solve. So my journey began from here, and I was in trance throughout my journey. So I have selected this topic, and through this work, I have made an attempt to solve the many complexities in my mind. And I hope this my research work will be more beneficial to homeopathic students and homeopathic doctor in future. So I have selected this topic for my research study. What are my aim and objective? To study the impact of emotional suppression on human being in different variety of cases. To study the phenomena of emotional suppression in various cases with its homeopathic management. To find out different system of body affected due to emotional suppression. These are my aim and objective. So first of all, I would like to share quote of the Sigmund Freud. Mainly he is the father of the psychology, and he has given wonderful quote: unexpressed emotions will never die, they are buried alive and they will come forth later in uglier form. Means unexpressed emotion which are very danger for number of the disease. So what is psychosomatic disease? Psychosomatic disease mainly word is made up of two words, psycho and somatic. Psycho is derived from the Greek word psyche, which is originally meant breathe. later acquired additional meaning soul. Somatic was drawn from the word stroma, which means building structure of the body and tissue. Psychosomatic disorders can be defined as the disorders characterized by the physiological changes but originate at least in part from emotional factor. So that is a mainly psychosomatic disease. Dr. Honeyman has given more important to psychosomatic disease in aphorism number 210 to 230. There are 4 types of classification of disease. 1 out of 4 corporeal disease caused by mental or emotional origin. That is a psychosomatic disease. So what is emotion? Emotion mainly that is our conscious experience and complex reaction pattern. There are mainly 6 basic emotions: happiness, sadness, fear, disgust, anger, and surprise. These are the mainly 6 our basic emotion. We can divide into 2: comfortable and uncomfortable. Comfortable emotions means joy, love, desire. That is all are the comfortable, which is mainly good for health. And uncomfortable means disappointment, grief, sadness, anger, violence. These all are the danger for our health. So we must know relation between emotions and hormones. As we all know that hypothalamus and limbic systems are mainly important for the genesis of emotion. We must know about 3 axes: HP axis, HPM axis, and PNA axis. First, HP axis, that is a hypothalamus, pituitary, and adrenal. Hypothalamus mainly sends corticoid releasing hormone to pituitary gland, which release adrenocorticotropic hormones in bloodstream, and adrenocorticotropic hormone stimulates adrenal cortex, which mainly release the cortisol, which is king of steroid. If it is in low level, then it is good for health, but if it increase in chronically, then it will be danger for the health. Second axis, HAM axis. Hypothalamus, adrenal, and medullary system. Hypothalamus mainly stimulates the adrenal gland, which release epinephrine and norepinephrine, and also catecholamines. Epinephrine and norepinephrine mainly responsible for increased heart rate and increase the blood supply. Catecholamine mainly important hormone, but if increase in chronic level and increase in hyper, then it mainly responsible for blood pressure and cardiac arrhythmias. So it mainly produces blood vessels wall thickness and ultimately collapse. Third axis, PNEI axis, this is a very important axis: psych, neuro, endocrine, and immune system. As we all know that mind acts on the body through 3 systems: CNS, endocrine, and immune system. When our psych will be deranged and disturbed, then directly and indirectly our NEI system will be deranged and lead to changes in the susceptibility to number of infection, inflammatory disease, autoimmune disease, communicable disease, and non-communicable disease. Let's see example. If any person have constant physical and psychological stress and stressful life, then in their body, pro-inflammatory cytokines release and binds with the immune molecules and produce the inflammatory disease. And in stressful life, in the person's body, cortisol release persistent and destroy the lymphocyte and immunosuppression. So it will produce number of GIT, respiratory, cardiac, neurological, endocrine, skin disease, and neoplastic disease. So what does it mean to suppress emotion and what causes suppressed emotion? So as you all know that what is disease, what is cure, what is suppression. So I don't want to go in that detail. What is emotional suppression? Every person will experience emotion. It is a part of human being. Happiness, sadness, anger, fear, surprise, disgust. These all are the common feelings that play important role in our daily life. When people have a hard time for expressing and accepting these feelings, they may suppress these feelings consciously or unconsciously. Why? Why they suppress? Because they are unable to handle them. Sometimes want to avoid more hurt and pain. Sometimes for self-protection. Sometimes for social expectation. Sometimes patient is fear that their emotion is not acceptable or their feeling are considered invalid. Sometimes patient.
Okay. Thank you for the messages from Dr. Ketan Shandor. Okay. Thank you, Harinath Sharma, doctor. I think, doctor, you're here, right? Dr. Pankaj, okay. What happened, doctor?
Network
Doctor,
issue.
okay.
Network disconnected.
Okay, no problem. You can continue.
Slide change from the. Okay, madam. Can I start, madam?
Yes.
Okay, madam. So patient opt to bottle up their emotions. Patient choose to tamp down their emotion. They may even create a constant state of fight or fight response. What will be outcome? It become part of the bigger picture of the disease because suppressing emotion is not a healthy coping mechanism. It can produce negative consequences for both mental and physical well-being. By understanding the underlying reason behind emotional suppression, we can begin to explore healthy way of expressing our emotions. Let's see example, grief expressed by deep sadness. Every person will have different reaction or expression to the death of loved one, loss or disappointment, that we can say emotional on psychic trauma. If one person is suffering from that grief, and you can resolve yourself by allowing the process to work without trying to interfere in it. We can experience the emotion normally and release the event without reaching to suppression. We experience emotion as a result of neuropeptides released from hypothalamus in response to thoughts. Each emotion has a specific chemical makeup that flows throughout the body, and it is picked up by the receptor site in various organs. Example, death of the loved one. Person wants to weep, they can release their emotion as per situation for some time or few months. In this way, we must react as per situation and release our emotion. That is our resolved emotion, which is mainly which don't produce any deep negative impact. Okay. Next. Person B. If you suppress your emotions, emotional trauma can lodge in the body as a NEC, neuro-emotional complex. And these unresolved emotions never die. When emotion become too intense, homeostatic balance is seriously disrupted in the body. This continuous imbalance will develop number of psychosomatic disorders. Now, homeopathic management. So as you all know that we people believe in individualization because each and every person have a different personality, different constitution, and every person how patient understand life and their different reaction. That is most important. So we must find out psychological connection between physical, mental, and metaphysical connection. I have seen during my practice in physical condition, 60 to 70% cases have a connection to metaphysical level and to the spiritual level, which is mainly help us and to find out why patient is suffering, why patient has a depression. We must discover that. In many cases, physical problems have a deep root at the subconscious level. That is that continues to trigger the bodies and imbalance the body, which develop the disease. So when we prescribe the constitutional medicine, if patient have any imbalance, then it make the true connection, and patient have understand very well what is their priorities, what is their position, and these true connection will mainly patients will better feel at the psychological level. And when patient feel start to psychological level, then immediately patient feel the better at the physical level. Review of literature. Dr. Heyman has given more important to psychosomatic disease in 210 and 230 aphorism. Dr. Jetikan also given most important part, that is a will and emotion, intellect part and emotional part. Dr. Hippocrates, father of medicine, he is given more important to emotional, psychic and spiritual plan. Dr. Vitholkas in a new model of men and disease is given more important hierarchy of symptoms, that is a mental, emotional and intellect. Dr. Rajan Sankaran has given more important to PNEI axis in spirit of homeopathy. Dr. Farooq Master in perceiving rubric of the mind, he has given more important to emotional pressure. Dr. Lagdi Sapir has given more important to level of suppression in his book Honeymanian Textbook of Classical Homeopathic for the Professional. Dr. Hammer has done wonderful work for the unresolved emotional conflict, and he has given more important to unresolved emotional conflict and importance of the organ and which emotion related with that organ. So materials and method, types of study. I have used descriptive observational type of clinical study. Source of data, cases of my private homeopathic clinic, Surat. Materials, case record performer of the clinic. Sample size, I have taken 300 cases. Sampling method, I have used randomized method. Materials, I have used case record performer according to Dr. Honeyman guidelines and homeopathic software like Homeopathy and Radar 10. Selection of criteria, inclusion criteria and exclusion criteria. In inclusion criteria, cases which had history of emotional suppression and cases had been taken from school-going children to old age, 70 years, and both sexes. Exclusion criteria, I have excluded pregnant woman, patient on concurrent suppressive treatment throughout the duration of homeopathic treatment. I have analyzed all the improvement in significant improvement, moderate improvement, status quo, and left the treatment. Significant improvement means feeling of the mental and physical well-being with disappearance of the all sign and symptoms. Moderate improvement, that is a feeling of the mental and physical well-being with relief in his suffering. Status quo means there is no change in the patient's any complaint. Patients remain as it is condition even after administration of homeopathic medicine. Left the treatment, patient didn't return for the further treatment. Data collection. So I have taken 300 cases, and out of 300 cases, 97 patients were male and 203 patients were female. I have taken all these cases which are chronic in nature. Age group 1 to 10 years of the age, 7 cases from 1 to 10 years. 27 cases from 11 to 20 years of age, 74 cases from the 21 to 30 years of age, 115 cases from the 31 to 40 years of age, 53 cases from the 41 to 50 years of age, 14 cases from the 51 to 60 years of age, and 10 cases from the 61 to 70 years of age. So you can observe that maximum patient 115 cases were coming from the 31 to 40 years of age. Treatment, I have used constitutional medicine with intercurrent remedy where it was required. Result of treatment, significant improvement I have seen in 177 cases, moderate improvement in 80 cases, status quo in 18 cases, and left the treatment in 25 cases. I have analyzed all the data. You can observe in graph, maximum patient were coming from the 31 to 40 years of age, then 21 to 30 years of age, and then 41 to 50 years of age. So these age group are most commonly affected because of emotional suppression. You can observe out of 300 cases, female 68% female were affected and 32% male were affected. See the chart. You can observe that out of 300 cases, maximum patient of the migraine, 62 patients of the migraine. Second disease, hypothyroidism most commonly occurs. Third, depression and eczema. Fourth, psoriasis, allergic bronchial asthma, GERD, DUB, PCOD, hypertension, erectile dysfunction, lichen planus, alopecia areata, urticaria, vitiligo, verruca vulgaris, epilepsy, keratoderma, acne vulgaris, and diabetes mellitus. These all are the diseases which are mainly produced because of the emotional suppression. These all are the remedy which I have used. You can observe that maximum in maximum patient, selection of remedy, choice of remedy, that is a natrum mure in 66 number of cases. Second, natrum carb, then phosphorus, natrum host, ephysagria, natrum sulf, lycopodium, magnesium carb, calcarea carb, natrum ars, ignatia, natrum silicata, aurum met, sepia, phosphoric acid, calcarea silicata, calcarea phos, calcarea ars, pulsatilla, sulfur, aurum sulf, magnesium sulf, argentum nitricum, and graphite. So you can find that in maximum cases, natrum, calcarea group and magnesium groups are more commonly occurs. I have also used intercurrent remedy with constitutional medicine. I have used thyroidinum in 37 cases, tuberculinum in 22 cases, thuja in 19 cases, histaminum in 12 cases, sorinum in 7 cases, and cipilinum in 3 cases. See, what are the different causative factor? These all are the because of emotional suppression. I have seen during my study in majority of the cases, 118 cases, I have seen anger suppress and intolerance of the contradiction. That was a main causative factor. Second one, love, disappointment, grief, brooding, and weeping. Third, death of loved one, parents, friends, sadness, melancholic, weeping. Fourth, loss of his job, position, reputation, money, and business. Fifth, abuse after being sexually, rudeness of others, domination, injustice can't support, children punishments, scolded being reproaches, offended being insult, honor wounded, bad news, rejected from being, humiliation, mortification. So these all are the causative factor. Mainly these are the emotion and emotional suppression, but different causative factor which are mainly responsible for the disease production. Types of emotion which are affected in most of the cases. I have seen the primary emotion that is mainly affected in 70% of the cases, then secondary emotion in 23% cases, and tertiary emotion that is in 7% cases. Result analysis, I have seen significant improvement in 59% of cases, moderate improvement in 27% of the cases, left the treatment in 8% of the cases, and status quo in 6% of the cases. These all are the cases. This is the case of the psoriasis. Main elements factor, loss of job, divorce, and I have selected remedy natrum ars. See result before and after. All patches were disappeared. Second case is infective eczematic dermatitis. This is a case of the BMS doctor, Ayurvedic doctor, and she had used everything, allopathic, Ayurvedic, then consult to me. Elements factor, grief, honor, wounded. I have selected remedy on the basis of totality, that is a natrum mur. Case of hypothyroidism, elements factor, family dispute, suppress anger, mental insecurity, and prescribed remedy calcarea ars. See TSH level before prescribed remedy more than 100, and after 1.5 years TSH level 3.83 without any allopathic medicine, only and only by homeopathic medicine. Case 4, case of PCOD, elements from engagement broken 2 times, brooding and self-reproaches. Choice of remedy was natrum phos. See report before prescribed medicine, PCOD, and after 6 months of medicine, there is no any significant abnormality seen in the study. This is very interesting case of the pompholics, elements from suppressed anger, strained relation with relatives and friends, causes emotional disturbance. Remedy phosphorus I have prescribed. See result before pompholics, after 4 months, all blisters were mainly burst, and after 9 months, you can observe patient recover completely. Case 6. This is again a very interesting case of 67 years of male, psoriasis. Elements factor, honor wounded, reproaches himself, duty conscious, and choice of remedy was aurum met. See, patient mainly had suffered from the psoriasis in lower extremities, and after 1 year, patient recovered completely. This is a case of gutted psoriasis. See, before patient had a many lesion in upper extremities and lower extremities, and after 5 months, patient felt better 30 to 40%. Main elements factor, domination, rudeness of others, and I have prescribed remedy magnesium carb. This is the photos after 5 months. See photos of the after 8 months, patient felt 60 to 70% better. But unfortunately, after 12 months, patient had a slight increase over the upper extremities. So that was increase after complete improvement. So patient had a low confidence and patient left the treatment. Again, it is interesting cases of the 13 years old boy. plantar keratoderma. See, before and after 1 month. Ailments factor sensitive to rudeness, reprimands, scolding, suppress anger. Remedy, choice of remedy, calcarea floor. See, before, after 1 month, there are huge cracks, bilateral sole. After 6 months, all cracks were resolved and exfoliation of the skin started. And after 11 months, patient had recovered completely. Case number 9, atopic dermatitis. Ailments factor suppress emotion, suppress anger, reproaches herself. Choice of remedy, natrum mure. See, before and after. Also, patient had a lesion over the upper extremities. See, this is a lesion over the upper extremity. Before and after. Also, palm were recovered before and after with the homeopathic medicine natrum mure. Case of vitiligo, elements from domination, sensitive to rudeness and repression. Choice of remedy, magnesium carb. See, before patches of vitiligo were recovered 50 to 60% after 8 months. After 8 months. See, patches of the vitiligo over the hand before and after. Maximum patches were recovered. See, vitiligo over the upper limb. Size of the patches were decreased and also color of the patches were changed. See, in the ear, patches completely recovered after 9 months. Over the abdomen, after 8 months, color of the patches were changed. Over the lower extremities, before and after 9 months, you can observe that 60 to 70% result were obtained. The patient under observation. So now discussion. During Hahnemann's time, he considered a few psychic diseases that have not merely derived from physical ones. Instead, with only slight physical illness, this disease arise and proceed from the psyche, from persistent grief, resentment, anger, humiliation, and repeated exposure to fear and fright. In time, such disease often greatly harm the physical health. This is a typical classical description of what you all observe of disease, which are mainly origin from emotional suppression. Niemann has described in 226 aphorism that in mind psychosomatic diseases, you can help them before it has extended themselves too much. We can help them greatly with psychotherapy, good living, and homeopathic medicine. As all these diseases which origin from emotions are related with soric miasm in background. Anti-soric medicine can be great help to them. The main objective of this research work is to show the efficacy of homeopathy in chronic diseases which origin from emotional suppression. During entire study, 300 cases were taken. In 300 cases, 97 patients were male and 203 were females. On the basis of nature of disease, all cases were chronic in nature. As per age incidence, 7 cases from 1 to 10 years of age, 27 cases from 11 to 20 years of age. I have already told you, so I don't want to go into detail. In all chronic cases, I have used constitutional medicine with intercurrent remedy. Summary and conclusion. During entire study, 300 cases were taken to understand the scope of homeopathy in disease which are origin from the emotional suppression. To draw conclusion, all cases were studied in detail. All 300 cases were of chronic disease in this study. During treatment, indicated remedy with appropriate counseling, psychotherapy approach was given. To prevent relapse, repetition of the medicine was done without an aggravation at proper intervals. In this study of 300 cases, effects of emotional suppression on body and mind were noticed in all type of disease as follow. 62 cases suffered from migraine, 37 hypothyroidism, 29 eczema, 29 depression, 24 psoriasis. This also we have discussed already, so we don't want to go into detail. In all the cases, fight and fire response to anger suppress, love disappointment, death of loved one, loss of job, position, reputation, money, business, rudeness of others, domination, insult, honor wounded, bad news, reprimands, and scolding. Rejected, humiliation leads to development of the disease, which are mainly origin from bad effect of the emotional suppression can be observed. For management, I have prescribed indicated constitutional remedy. With psychotherapy, counseling can produce good result in more than 59% of the cases and moderate improvement in 26% of the cases. Modern psychosomatic disease are migraine, hypothyroidism, atopic dermatitis, depression, ulcerative peptic disorders, diabetes mellitus, primary hypertension, ulcerative colitis, psoriasis, leukoderma, irritable bowel disease, erectile dysfunction, insomnia. Disease can be managed well with homeopathic remedy rather than crude doses of the modern medicine. In modern era, homeopathic medicine has a wide and good scope in treatment of psychosomatic disease, in which most cases have history of emotional suppression. So we can say homeopathy is the best stress booster for unresolved emotional conflict. These all are the bibliography. I have taken many references from the different books. These all are the books. These are the different websites from which I have taken a number of references. So thank you so much to Danesh sir and his team. Thank you so much, madam, and thank you all of you for giving valuable your time. Thank you.
Thank you, Dr. Pankaj. It was really a wonderful cases you have shown here. That is a really miraculous. And
Thank you.
I think we have 30 minutes for discussion. If anyone wanted to know about uh, this research and regarding this subject, you can come forward and raise your hands and ask question to Dr. Pankaj. Uh,
Anyone have any doubt, any confusion, you can ask me.
Doctor, you have given more importance for the emotion than selecting the constitutional remedy, right? Not
Yes,
not
madam.
not given more importance to the constitution. Uh, the priority is for emotion, right?
Yes, madam. Actually, madam, I have prescribed medicine on the basis of totality.
Hmm.
The emotional suppression were part of the totality. That is not a different entity, but it is a part of the totality. That is a mainly entry point of the medicine, core of the medicine. That is the
Okay.
emotional suppression. I have covered emotional suppression, but also I have covered all the symptoms.
Okay. Thank you. And Dr. Indranil has raised hand. You can ask, doctor. Oh, sorry. I pressed. You can.
Yeah. Sorry, in this, like, it was a good presentation with a good data of
Thank
study.
you.
Like, I would like to ask that there are usually we consider as will, intellect, emotions, and memory, like in mind, or the PA and EI axis. That I think you already must have known it. In such cases, should we consider the physical generals or only the mind part for managing such cases? Means emotion is one part. Huh? Will,
Yes.
emotions, intellect, and memory. These are the four things which usually we consider.
Sir, I have told you in during my discussion that
Huh.
I have prescribed medicine on the basis of totality. Totality means it covers mental symptom,
Physical thought.
physical, and characteristic particular. But what was my entry point? That is the mainly emotional suppression. I
Okay.
have differentiate all the medicine on the basis of physical, general, and mental. But main entry
Acha.
point that is
So,
emotion. My medicine must cover that types of emotions.
emotions, yeah, because these all modern lifestyle diseases are all because of
Yes.
the emotions we
Yes.
see. That is
I have
very
seen
true.
that in
Yeah.
60 to 70% of the cases, that is main cause of the disease, that is an emotion.
Yeah, very true. Okay. No problem. Yeah, thank you.
Thank you, sir.
Dr. Chetan, you can ask your question here. You have mentioned a question in the chat box, sir. In the cases of vitiligo, which type of psychodynamics is involved? If this is a question from Dr. Chetan Dangar. Uh, If you want, you can unmute yourself and come forward. Otherwise, please answer.
Sir,
Dr.
in the vitiligo,
Yeah.
yes, yes.
Vitiligo, which type of psychodynamics is involved?
Mainly there is a disconnectivity with the own person. That is a mainly autoimmune disease. And when autoimmune disease will produce, when patient have a conflict with the own person, with loved one, with near and dear, then we believe that that type of autoimmune disease, right, like vitiligo, rheumatoid arthritis, psoriasis, lichen planus, this type of disease will develop. The main psychodynamics is involved, that is a conflict with the relation of the near and dear.
Okay. Dr. Sagar, you unmute yourself and come forward. Okay, you can ask now, Dr. Sagar. Please, Dr. Sagar. Hello. You can talk now, Dr. Sagar. You are unmuted now. You can talk now, Dr. Sagar. I don't know what is happening. Dr. Sagar, you can talk
Okay,
now.
madam, anyone? I think.
don't know. And there are some appreciation, much informative talk. Dr. Ram Parvesha, you have mentioned something in the comment. You can unmute yourself. Dr. Sagar again raised hand. Okay. Unmute yourself and ask. Okay.
Thanks
Dr.
to everyone for your appreciable word.
Dr. Ram Parvesha, you can ask now.
Thank you, Dr. Andini, and congratulations, Dr. Pankaj sir.
Thank you,
nice,
sir.
very nice presentation.
Thank you, sir.
All cases is describe the describe and beauty of homeopathy. Emotional suppression, main cause of disease according to law of homeopathic science, mind. So emotional suppression is a very good. Anger suppression, 50% case. Anger suppression, Lycoderma, psoriasis, etc. Insultive suppression. Insultive suppression after complaint, diabetes and psoriasis case. So very nice presentation, excellent session. Thank you, Dr. Pankaj sir.
Thank you, sir. Thank you.
Very, very thanks.
Thank you,
And Dr. Chetan has asked the question again. Dr. Chetan, you please come forward and ask question. Dr. Chetan, I'll unmute you. Chetan. Please.
Hello.
I unmuted. Okay.
हेलो
Please. Yes, you are on.
पंकज पंकज सर, मेरे पास एक विटिलिगो का चाइल्ड है, तो उसमें भी ये कॉन्फ्लिक्ट विद रिलेटिव्स ये सोच सकते हैं क्या?
नहीं, ऐसा है ना सर, के ऐसा नहीं है कि विटिलिगो है तो हर चीज में, हर पेशेंट में हमको ऐसा कॉम्प्लेक्स दिखेगा ही. एक रिसर्च स्टडी है कि हम इन मेजोरिटी ऑफ द पेशेंट वी कैन सी, बट वी कैन नॉट से ईच एंड एवरी पेशेंट हैज दैट सेम टाइप ऑफ कॉम्प्लेक्स इन विटिलिगो.
ओके, लेकिन बेसिकली चाइल्ड है तो क्या सोच सकते हैं? मतलब आप स्पेशली आप बोल रहे हैं कि आप इमोशन पे ध्यान दे रहे हैं.
देयर आर मेनी कॉज ऑफ द विटिलिगो. ठीक है,
Okay.
फूड हैबिट है उसकी. अभी जो एकदम न्यूट फूड है, पैकेट फूड, जिसमें बहुत सारे केमिकल्स आते हैं. तो अभी आप देखते हैं कि बहुत सारे बच्चे में विटिलिगो केसेस हमको दिखता है. बच्चे में
Yes,
6-7 इयर्स ओल्ड बच्चे हैं, उसमें भी विटिलिगो है. तो हमको ऐसा लगता है उसमें कौन सा इमोशनल सप्रेशन है, कौन सी फैमिली हिस्ट्री है. मगर देर आर
Right, sir.
मे बी कॉज ऑफ द फूड एडिल्ट्रेशन जो हम बोलते हैं, जो सब चीज में अभी केमिकल्स आते हैं. तो बच्चे जो पैकेट्स प्रिजर्व फूड जो लेते हैं, तो वन ऑफ द कॉज
Okay.
of the vitiligo.
तो सर पैकेज फूड और फास्ट फूड वगैरह थोड़ा अवॉइड करवा सकते हैं ना ऐसे पेशेंट में?
इजीली हमको उसको बोलना ही पड़ेगा कि पैकेट फूड और प्रिजर्व फूड, वो विटिलिगो के लिए नहीं, सब बच्चों के लिए। अभी हमने एक रिसर्च स्टडी आर्टिकल टाइम्स ऑफ इंडिया में पढ़ा कि जो जीबीएस है, जीबीएस का केसेस बहुत बढ़ते जा रहे हैं। तो उसका मेन कोज ये है, ब्रेड है, जो भी मेहंदी के आइटम है वो सब है, ठीक है। और ऑटिज्म, एडीएचडी का केसेस जो बढ़ते जा रहे हैं, उसमें भी फूड का बहुत सारा रोल है। तो फूड का तो जो है डाइट रेजिमेंट हमको जो डॉक्टर है मैंने समझाया है, तो फूड का डाइट रेजिमेंट को हमको कंपलसरी फॉलो करना ही है सब केसेस में।
Child suffering from vitiligo due to suppression या जो vaccination problem. Vaccination problem is a very
Yes.
important, and family history, background of leukoderma, and any types of disease, skin separate disease during pregnancy, emotional disease, child suffering from vitiligo and leukoderma.
Also, we can take a history of mothers during pregnancy.
Yes.
That is also important.
Very, very, very important.
Yes.
Yeah, I think
main cause of today is the emotional cause. So main cause of disease, homeopathic law of homeopathic mind. तो हम बता सकते हैं एक एक इमोशनल से बीमारी का है, कॉज है। सुनहु तात मानस रोगा, जिनसे दुख पावहि सब। मोह सकल व्याधिन कर मूला, तिनते पुनि उपजहि बहुसूला। कहा में बात कप लोभ अपारा, क्रोध पित्त नित छाती जारा। तीनों भाई करहि प्रीति, उपजहि संपाद दुखदाई। विषय मनोरथ दुर्गम नाना, पेशव नाम सुनको जाना। पर सुख देखी जरनी सोचै, कुष्ठ दूसता मन कटुलाई। अहंकार अति दुख डमरुआ, मद कपट मद मान हरुआ। दूसरे को सुख कर देखकर यदि डाही प्रवृत्ति मन में उपजता है, उसकी वाइटलिटी पूरा ड्रेन होता है और उसके अंदर में ट्यूबरकुलोसिस का बैक्टीरिया ग्रोथ कर देता है और क्षय रोग होता है। हाँ, मन में कुछ बोलता है, कुछ करता है, कुछ है ना। तो वैसे व्यक्ति को उसके अंदर में जो है लेप्रोसी का सिम्टम प्रोड्यूस होता है। तो हमारा एक एक लोभी व्यक्ति को कफ का फॉर्मेशन होता है, क्रोधी व्यक्ति को गैस का फॉर्मेशन होता है। एंगर जो क्रोधी है उसको जो है काम बात कप लोभ पारा, कामुक व्यक्ति को बात का शिकायत होता है, जो साइकोटिक नेचर में आया है। गोनोकोकस से बैकग्राउंड यदि उठाइएगा पास्ट हिस्ट्री में, तो उसकी मदर फादर कहीं ना कहीं जो है सप्रेस गोनोकोकस का जो है एलोपैथिक ट्रीटमेंट लेकर सप्रेस करके उसके बाद बच्चा पैदा हुआ है, तो उसके अंदर में इस तरह का जो है बीमारी था, समझे ना। तो एक एक इनविजिबल से विजिबल कारण जो है इनविजिबल है और रिजल्ट जो है विजिबल है। तो यह जो है होम्योपैथिक साइंस है। The main cause of disease invisible and mind suppression। तो होम्योपैथी का पहला पॉइंट है, only one word, any chronic disease due to suppress।
Thank you,
thanks,
Dr. Thank you, Dr. Indranil. Thank you, Dr. Ram Parvesha. Dr. Indranil, you can ask. Doctor, you can ask now. You're unmuted. Dr. Indranil, are you there? Hello? Hello? What happened? I think we have some network problem. And Dr. Mariam Salcedo said amazing section. Are you here, Dr. Mariam? I couldn't find you out. Dr. Indranil, please.
Yeah. Can you hear me? Yeah. Sir, two basic questions only. Many a times, like in these emotions cases, like ignatia, nitramur, staphysaria, these are the remedies which commonly come up in our reportization. So kindly express your views about these remedies. Are they leading or some others can also come? One part. And there is a small additional question which I will definitely ask you after this.
Sir, why this remedy commonly occurs? Because this remedy have a core and nucleus of the mental emotional disappointment, grief, love, and these all are the causative factor which are most commonly occurs nowadays in a young age. So these causative factors are most commonly occurs. That's why these remedies are most commonly occurs. So I don't
Yeah,
believe,
yeah.
if I have seen 10 cases of migraine and I select Netrum Car, Netrum Mure, I don't believe any uncommon remedy. I don't believe that
Okay.
prescribe any uncommon
Less
remedy.
proven, less proven remedy. Yeah, less
If
proven
your
remedy.
common
Yeah,
remedy will give better result, then why you select the uncommon remedy? I have
okay.
get
But do they
maximum
pop up all the
result.
time?
I have get maximum result within 80 to 90 remedies, which is mainly used by honeymen
Yeah.
during that era.
Very true. Very
And
true.
that is most
Very,
common
very
remedy.
true. Very true. And secondly, sir, a small query that sometimes emotional part is definitely there in many cases, but the most of the time the physical journals and the pathological symptoms they dominate. So should we give importance to the emotions in such states?
No, sir. No, sir. We must prescribe remedy on the basis of totality. Patient's case have a more physical general. Then we have to go for other approach. If patient case have a more pathological general, then we have to go for Boger approach. So we have a different
Yeah,
approach for the totality analysis.
yeah, yeah,
So we
yeah,
must
yeah.
prescribe
There are several
remedy on the
things.
basis of different approach.
Yeah, yeah. But in such cases, like in your presentation, should you do you give importance to only emotions, or you consider the
No,
pathologies first and the
no, sir, no, sir.
physical?
No, sir. I have considered all things: physical, general, characteristic, particular, mental,
Yeah, yeah, yeah.
pathological. Sometimes I have cases which have only one or two symptoms. In, for
Very true.
example, warts over the tip of nose. There are
Yeah,
no any other symptom. Then we have to
yeah.
prescribe medicine on the basis of warts and location on the tip of nose.
If I'm
That's
not,
all.
it is not wrong. It is causticum probably.
Yes, yes, sir. Definitely, causticum. We must go with the causticum.
Very true. So when there is paucity of symptoms, we can say.
Definitely, sir. Definitely.
Correct, correct.
Again,
Thanks for the
paucity of symptom that is because of suppression. Suppression of
suppression.
allopathic medicine or any other.
Okay, okay, okay. Thanks for your explanation, sir.
Thank you. Thank you.
Thank you, Dr. Indranil. Now I think there is no question now. How long it took for finish your research?
Sir, madam, I have taken 6 years.
Whoa, 6
From
years.
2018 to 2024, and recently I have completed my PhD
Oh, okay.
under the guidance of Dr. Girish Patel, sir, before 2 months.
Okay, okay. That's a long time. I'm appreciating your patience.
Because of sample size, madam, I have taken 300 cases. So because of sample size, yes, it depends on the sample size. My sample size was somehow bigger, 300 cases.
Okay. And what is the role of homeopathy in managing psychosomatic symptoms in patients with chronic illness, such as diabetes and heart diseases? It's a question
The role
from
of homeopathy in managing
Panjal Dhruvi. What is the role of homeopathy in managing psychosomatic symptoms in patients with chronic illness such as diabetes and heart diseases?
So, Dr. Dhruvi, very honestly speaking, I didn't see any cases of heart disease, and I didn't cure any cases of heart disease. But I cured the cases of diabetes, where main cause of the disease, that is a stress. And nowadays, in a 21st century, stress is the main cause of the diabetes. If you relieve the mind and relieve the stress, majority of the diabetes cases will get a benefit.
So it's completely cured, right? Now, not taking any medicine. The diabetic cases I'm asking.
As per my knowledge, madam, I never use a word cure for hypothyroidism, diabetes, hypertension. These all are the life mainly because of life. So we have to maintain our life after cure the patient. So always I advise the patient, Please
So,
balance your life.
You're managing after giving medicine. Now they are pop up with the stress management and all, or what?
Definitely, madam. After completion of the medicine, we must give advice for the balanced life, either mentally or physically.
Taught, I mean, exercise, diet, everything.
Simple meditation or relaxation, anything. 5 minutes, any pranayam, relaxation, meditation, it will be beneficial for the balancing of life.
So now it is in control, right?
Yes, yes, madam.
And Shivam Parmar, well understanding on discussion. Thank you so much to conduct such a great session in discussion. I'm joined late, but the discussion is good, but approach based on. Okay, thank you. Thank you, Parmar, Dr. Parmar. And now Dr. Hariharan can ask question. Dr. Hariharan, please.
Okay, doctor, I have not heard your class, but even then, I heard the suggestions of certain doctors, and I understood that it is now your class is dealing with emotions, mental stress, mental symptoms. That is all. See, I want to ask a question to you: is that have you tried bad flower remedies along with the homeopathic medicine for mental diseases? That is my question.
Sorry, I didn't get.
Sir,
voice.
sir, are you used see back flower remedies along with homeopathic medicine for such emotional diseases? Suppose a migraine patient is coming to you with a typical anxiety, and you try homeopathic medicine, and will you give that back flower remedies also
Have you
along
tried
with the
bash flower
homeopathic
remedy?
medicine?
Bash flower
Back
remedy.
flower remedies.
Okay. No, sir. Very honestly, I didn't know much more for the about the batch flower remedy. So I didn't use any batch flower medicine.
Sir,
If you have any knowledge, please share.
okay, okay, sir. See, my experience, I have about 45 years experience in homeopathy. But now I am using this back flower remedies along with homeopathic medicine, and I am getting wonderful result.
Okay.
So that
Good.
I am asking this post. See, for anxiety, fear, see, such cases, along with homeopathic medicine, we will get best result. That you can, I'm not advising you, but it is a suggestion that you try
Okay, good.
back flower remedies along with homeopathic medicine. You will get wonderful result. I assure you. Try it.
Definitely, sir. I keep this point in my mind. And I request to madam our next webinar on the topic of batch flower.
We had many webinars here. Actually, one doctor is Dr. Shaila. What is the name of that doctor? He's
That Govi Krishnan, one Govi Krishnan from Palakkad. He is wonderfully.
Please unmute.
He is wonderfully using, see, back flower remedies, and I have a lot of books along in my library, and one of the main person is I think Dr. C. Farooq. What doctor?
Farooq Master.
Farooq Master. Farooq Master.
Yes.
And doctor is Farooq Master. And his book regarding back flower is with me, and I am using this back flower along with homeopathic medicine, and independently also I am using it, doctor.
We had many classes about bash flower remedies.
Today also.
Today also.
Okay.
Okay. And
Sir, another question is nobody is raised their hand, so I am asking again and again. No?
Have 3 more minutes.
Did you try this LM potencies in homeopathy or centesimal or decimal? Which potency you are preferring, doctor?
Sir, I have used LM potency in pathological cases, especially in last stage of the malignancy and COPD. I have used LM potency where frequent repetition is needed. 0/1 and 0/2.
0/2. Okay. That is good, doctor. That is good. I am also using LM potencies now, and I am getting so much result for LM potencies.
It gives wonderful result in a frequent repetition, especially in a last stage of the cases.
Okay, very correct, very correct.
Yes.
You say it is showing wonderful result, and we can use it in chronic diseases, and we can avoid the homeopathic aggravation in certain extent. Certainly, homeopathic aggravation is there, but it is not give see any discomfort to the patient. It is very small homeopathic aggravation is there.
Yes, sir. Thank you, sir.
Okay, then I think there is no questions. We have another session in our local language Malayalam, so we'll move to the Malayalam session. Thank you so much, Dr. Pankaj, for your presentation. Actually, you have done this work. It took 6 years. Within 1 hour, you have explained everything for us like spoon feeding. And thank you so much for your presentation and for your research work. And congratulations for you for doing more work, research work and all. Thank you so much, and thank you for joining with.
Thanks to everyone.
Thank you. On behalf of IFPH, I'm giving you thank you. And thank you all the participants for joining with us. See you tomorrow the same time with another faculty. Bye-bye. Now I am inviting Dr. P. Shaila for moderating Malayalam session. Doctor.